lives. So the golden oldie, this is Mr. Bumble, now 11. And the golden oldie can be split into 3 separate sections. It can be split into the mature cat, 7 to 10 years old, which is 44 to 56 years old in human terms. The senior cat, 11 to 14 years old, which is 60 to 72 years old. And then the geriatric, which is 15 to 21 years old, which is 76 to 100. Bless them. So at this stage in life, at the vets, we don't want to see you twice a year, we want to see you 4 times a year. Does anybody have a cat in this age range at the moment? Yeah. And do your vets advise blood and urine tests? Okay. In this age range, cats are very, very susceptible to medical problems. Their organs are a bit older, so they're deteriorating a bit, they're not working as well, and they're susceptible to medical diseases. One of the most common ones is kidney disease. Now, kidney disease can start from a very young age in terms of cats' lives. It can start as young as 7 or 8. When we see the problems that we notice, so the clinical symptoms of kidney disease, there's over 75% damage done to both of your cat's kidneys at that point in time. So they've got a very limited kidney function then. We can pick kidney disease up very early on via a simple urine test, followed by a blood test if we suspect it on the urine test. It's something that should be getting done in older cats, at least when they come in. If you only take your cats to the vets once a year, ask about a geriatric profile, ask about a senior profile. We want to see 4 times a year because the aging process is so vast at this point in time and the changes can happen so quickly. We also get a lot of people just phoning us up and saying, oh, he's losing a bit of weight just because he's getting on a bit, he's just getting old. A lot of the things that you're seeing that you attribute to them just getting on a bit and just getting a little bit old can actually be put down to medical conditions that we can help them with. So common medical problems. This little guy here is suffering with hyperthyroidism. Anybody got a cat's hyperthyroid? No? I had a lot more people with problems yesterday. So hyperthyroid cats. Hyperthyroid cats will lose weight because they've got an overactive thyroid. You will see them eating a lot more and losing weight. You might also see them getting a little bit more scatty and a little bit hyperactive. These are symptoms of hyperthyroidism. So we've discussed kidney disease. Dental disease, again, this can have an effect on the kidney disease. So dental disease is very important to make sure that you keep on top of in the older stages. Osteoarthritis, cats are very, very good at hiding pain. Because they're solitary animals in the wild, they don't have the security of the pack to look after them. Therefore, in the society that they live in, they've got to look after themselves, so they can hide anything very, very well. Osteoarthritis is one of those diseases that is becoming more and more common the more time goes on, and we're learning about it and we're able to help our cats out much the same way that we can help ourselves out with joint supplements, diet changes, losing weight, and eventually we can help them with pain relief as well. Diabetes mellitus is another one that is quite common in older cats. We won't go into that now, it'll take too long. And cancer, unfortunately cats are very susceptible to cancer as well. One of the most common ones is lymphoma. And cats can be treated against these cancers now with varying success rates. So what you might notice that you might just attribute them to being a little bit older is drinking more, and I'll just run through these quickly. So poor appetite, losing their appetite, going off their food, weight loss, lethargy, just sleeping a little bit more. When it comes to osteoarthritis, it can be things as subtle as not being able to jump up on the sofa, not being able to jump up on the windowsill. And you can help out in these sort of stages by putting something in the way, so putting a blanket box so that they can still get up and look out as to where they want to be. Poor coat condition. Vomiting, again, this can be attributed to several things, and kidney disease is one of those factors. Inappropriate urination and not going out as much. These can be associated with osteoarthritis. If you think about where your cat flap is, cats have got to get up and jump out. If you've got a cat that's got very sore joints, this can be an issue. in and out the litter tray. Again, if you've got a covered litter tray and they're having to go in and out of it, you might have to find getting a shallower litter tray at this age stage is appropriate for them. And drinking more than usual, as we can see here. Just when I'm talking about drinking more than usual, a little tip: if you think your cat doesn't drink a lot of water, make sure that your food station and water stations are kept completely separate. Cats don't like to eat and drink in the same place. So where for years we've been giving them these little two-section drinking and feeding stations, they don't like that. You might find your cat will drink out of a tap, out of a puddle, out of the pond, anywhere but where you put the water. Try putting water around in different containers. I noticed this through one of my cats drinking out of a glass of water. Wherever I put it down, the cat's head would be stuck in it. So I now leave a glass of water out for one of my cats. And urinating more than usual can be attributed to drinking more than usual. So behaviour when we get to this stage in life, this little caricature here is a cat in a East Human's bed saying, "Who are you and what are you doing in my house?" Has anybody got an older cat at the moment? Has anybody had an older cat? Anybody noticed their older cat wandering around aimlessly at night making a noise similar to meow? For no reason in particular. This can be attributed to what we call cognitive dysfunction, which is similar to a sort of senile dementia. So they're just not as much aware as what they used to be. Again, there are products out there that can help with this problem. Products like Activate can help with this problem. It's a nutritional supplement and we've had great success with it in a few of our cases. Inappropriate elimination, again, osteoarthritis or cognitive dysfunction, they just don't know where the litter tray is, they don't remember. So helping them out with these sort of medical treatments can help this. Aggression isn't necessarily down to a behavioural issue at this age. It can be more attributed to medical diseases such as hypothyroidism. Just being a little bit more overactive, they can get a little bit aggressive sometimes with this disease.